We are from the University of Washington in Seattle, and our mission is to deliver innovative, free online education and training to diagnose, treat, and prevent infectious diseases. And we have created and manage these 5 sites, and they all offer no-cost continuing education, CME, CNE, pharmacology, CE for APNs and CE, and also certificates of completion. And HRSA, Human Resources Service Administration, funds these 2 websites, HIV and HIV PrEP, and then the National STD curriculum and the 2 hepatitis sites are funded by the CDC, and then CDC also funds the National HIV PrEP curriculum. And as you can see, there's different descriptions about all the different features on the websites, and we will be kind of, really delving into the unique characteristics. I do want to highlight we have more than 247,000 unduplicated registered learners on our site. So that means one registered learner might be registered on multiple sites, but this is unduplicated. And as you can see, they're very busy on our site over these last, we started this around 2016. And the requirements to earn CE versus certificates of completion are exactly the same, but certificates of completion are for people who need to document their work, such as students, trainees, residents, fellows, etc. So why are all these people coming to IDEA? We have subject matter experts. There's more than 80 of them. They're all working clinicians or medical school faculty. We have that free CE that we mentioned, no pharma bias. And we designed these curricula from the ground up. So we control how all the features and we create the features. And we really emphasize innovation, as we'll highlight that. Our content is up to date as much as we can keep it. Guidelines are released. We try to update all of the relevant content across all of our curricula, including references and resources, and then a variety of learning mediums. So we recognize we all learn differently, and we are basing stuff on adult learning theory principles. So we're trying to use a lot of different ways to make people learn and also retain the information. And we talked about unduplicated learners. And so you have one email and one password, and you can use them on all of our sites. And you can also access all of our sites on your phone, on a tablet, on your computer. And once you learn the navigation, oh, this is how I earn CE, this is how I earn a certificate of completion, is exactly the same on all of our sites. And we'll talk about learning groups in this presentation briefly. And what we're seeing are a lot more clinics and medical schools, nursing schools are creating learning groups to help get everybody on the same page. And as you can see, that's a popular thing. And we have many groups, and this is our small but mighty group. And I'm going to stop sharing that screen for a moment. And then I am going to share our program goals. Hopefully I will shift successfully. Yes. So we have, does everybody see the slide, the main slide deck? Okay. So the program goals really are these 4, and we can summarize them by saying that we hope the curricula improve and enhance the competency of people currently working, but also to expand the number of people in the pipeline. So those trainees, those fellows, those residents, and then help both of these populations to improve the quality of medical care and prevent new infections among persons at risk. So that's our goals. And we do that through a variety of methods, as we just highlighted. And I just want to pull out, since we developed the curricula, We created 2 versions of the lesson. So quick reference means you don't have to sign in, you don't have to register, you can just quickly look through and find the content. Our tools and calculators are the same thing. You don't have to register, just get the content, get what you need. And we recognize health professionals are very busy. And so we offer a progress tracker so you can come back to the site and start where you left off. And then this is the amount of CE that is available currently on all 5 of our sites. I want to highlight this pharmacology CE for advanced practice nurses. We know how difficult that can be to find that CE. And also it's difficult to find it when it's free and online. And also when you're listening and watching this presentation, you're going to hear like, oh, this is 3rd edition, this is 4th edition. And that means we have started a new CE accreditation period. And so every time we start a new CE, every time we release a new edition, let's say you are in CNE on the previous edition on chlamydia or something, you can earn CNE again on chlamydia in the current edition because we have reviewed and updated all of that content. And so before I turn this over to Todd, who's going to illustrate those common features using hepatitis C online, please, you can put your questions in the chat and we can answer them at the end, and then there will be time for a question and answer session. So Todd, I'll let you take it away.
All right, great. Thank you, Julia. So we'll start with the hepatitis C online, like Julia mentioned, and this is the landing page when you are not signed into the site. So, but you can see that they're up in the right-hand corner. That's the button there to sign in or register. And for those of you who have maybe used the site before but haven't visited in the past year, you may notice that it looks a little different. We have been rolling out a new platform and switching all of our sites to this more streamlined look, which is also easier to view on mobile. You can see that the HCO is currently in its 4th edition, as Julia had mentioned. It is our oldest curricula. And this page shows the different modules. So up top, we have this HCV testing cure module, which launched last year. And this is really intended to be a one-stop shop for clinicians to learn about providing simplified treatment of Hep C using direct-acting antivirals. And it's a very interactive course, which takes just about 5 hours to complete. And then below that are 6 other expanded modules, which take a deeper dive into clinical care for hepatitis C. And this is what that landing page looks like when you are signed in. So you can see your progress trackers, and the lessons can be accessed through these drop-downs. So like Julia mentioned, there's quick reference, and there's also self-study, and you can see the content is exactly the same in both. It's just a different way to use it. And since the lessons are really the sort of meat and potatoes of the site, I'd like to quickly walk you through one here in quick reference. So in quick reference, the lesson is all on one page, so you can scroll down through the content. And there's also this table of contents on the right, which you can use to jump to different sections. And then there is this navigation here on the left, which you can use to access different lessons. And this module has a welcome video by Dr. Carolyn Wester, who is the director of the Division of Viral Hepatitis at CDC. And as I scroll down, you can see that there are these figures and tables embedded directly into the content. And we also have these image series, which you can use to see things like hepatitis C prevalence and incidence. We also have these check on learning questions, which learners can use to sort of test their knowledge as they work through the material. And these are very popular. We found that about more than 90% of our learners will answer all of these questions. And I just wanted to highlight here this image of the natural progression of hepatitis C if left untreated. And the module also features several different interactive exercises like this one here for interpreting diagnostic laboratory test results. So it'll present a scenario and you can answer the question. So that's an example of a correct answer. And if you were to get it wrong, you can then view the correct interpretation. And then this is what the self-study module looks like. So you can see where you left off on your progress tracker down here. You can also access the lessons through this navigation ribbon up here. And a lesson overview page will show the lesson plan topics here on the right, which will fill in with a check mark once you've completed them. And then the yellow box on the left has information about the CE that is offered, including the steps to attain certificates. And then we also have learning objectives and information about the contributors, including any disclosures. And once you have viewed all the topics and these have all filled in, you can take the lesson quiz, which is 5 multiple choice questions, and you must get 80% to pass the quiz and then take a brief survey to earn CE or certificates. And you can also access your certificates from this navigation ribbon. And this is another way you can track your progress towards earning these certificates. And then this module is unique in that you can earn an optional training certificate, HCV test and cure training certificate. So when you've successfully completed the 5 lessons, it will unlock this knowledge assessment, which is a 20-question open book test that you can take to earn the training certificate. So that is really just a quick overview of how the lessons work within the modules. So moving along this upper navigation bar, there's also this HCV medication section, and you can access the different medications from the drop-down to see prescribing information. There's a table of contents here on the right to navigate, and then we have these other tabs here for clinical trials and references. There are slide decks and also a section for teaching resources. The site also features 11 clinical tools and calculators, and these are very popular because you can use them, right in the clinic, directly working with the patient. You can use it on any device, and none of the information used here is saved. None of the data is saved. None of the information is shared. And then both of our hepatitis sites have these clinical challenges sections, which will feature challenging or controversial cases. So you can read a case-based scenario, and then you can choose an option and submit, and this will show how other people responded, and then 2 different expert opinions. And then we also have these mini lectures, which are available on all but one of our sites. And these are really just sort of concise explorations of clinically relevant topics. And you can use this here on the right, this navigation to jump to different chapters. And then you can also download a PDF or PowerPoint of the slides. And then this section here shows how you can get free confidential one-on-one guidance from other clinicians through the National Clinical Consultation Center. And then we have this HCV biology section, which features very detailed illustrations and descriptions of HCV structure, proteins, and the multiple steps in the life cycle. And these are really helpful with understanding the mechanism of action for the medications. So you can scroll through the images, or you can use this navigation here on the left. You can also use this to jump to the other sections and interact with those as well.
God, this is super impressive.
Oh,
Wow.
thank you.
Did you design it? No, I'm kidding.
Yeah, I did it all myself. Thank you.
Is there like point of care credit that you can get? Like if you're looking up all those looking up the dosages and everything kind of thing? Or is it just if you go through the sessions regular way. I'll put it that way.
Yeah, CE is only available through our lessons, and then we'll show you the question banks. So that's the only way you can earn any kind of CE.
Yeah.
Very nice.
Thank you.
And we are accredited by the University of Alabama School of Medicine and then the Oregon Nursing Association for our CNE.
Sure. And then the last thing I wanted to show you, so if at the bottom of any page, you can click on About to find out more information about the site. And on our sites, this section will always have this About tab, and then there will be bibliography, CE notices, certifications, information on contributors, copyright, our privacy policy, and then the terms and conditions. And so that is just a very quick overview of hepatitis C online. And so I will now hand it over to Julia to look at another site.
Thank you, Todd. So our next site that we're going to look at is the National STD Curriculum, and it's probably has the most people who have registered on this site. And the difference you can see between a hepatitis C online one is this has lessons. There are not modules. And I just want to take a quick look at this syphilis during pregnancy and congenital syphilis. We launched this in August. The rest of the current edition launched in April, but we have a video. The National STD Curriculum lessons all have those check on learning and images in series, but I wanted to show, I know in Hawaii you don't have that many counties, but I still want to show this interactive map that we have that we created. So this is for women in childbearing ages, and you can just click on it to see, oh, okay, this is more, the rate is more than this, so the screening recommendation is that, but for Maui County, it's a different screening guideline. So, and then also we recognize a lot of healthcare professionals may not be as familiar with, what does congenital syphilis look like? And so we've created this interactive guide, a visual guide with images and photos, and you can scroll on the left, you can scroll, just keep scrolling down to view different photos and images. So this again is just showing you how we keep innovating and trying to present information in a different way. Now, question banks, we have question banks only in the National STD Curriculum and in the National HIV Curriculum. So I'm going to take this opportunity to show you how the question bank topic works. As you see, there's quite a few topics. There's 29, and they correspond with the 2021 CDC treatment guidelines. And I'm just going to choose one particular topic. And so you can see the layout is similar to the lesson. You have the yellow CE box, you have the authors, you have the learning objectives, and you have the option. You can access the question bank topic without signing in, or you can sign in and earn CE. And when you're signed in, it's generally, if it's 10 questions, you get 1.0, 5 questions, you get 0.5. And the nice thing is, if you want to skip around or you're looking for a particular one, like, oh, wait a minute, I remember this, but I don't remember what to do. So let's say you're treating a woman who's pregnant that has chlamydia. You're going to see a clinical scenario. There will always be a simple question stem and then 4 choices. And I'm just going to choose an answer. I check the answer. Woohoo, I got it right because I practiced earlier today. And you see a summary of the answer. If there's a relevant table or figure, we'll include that. And then we will always have references. So you can just kind of work through, you can navigate, back and forth this way or up on top. And then there is a progress tracker, of course, once you're signed in to measure all of your question bank progress. And I don't know how many of you might be aware, but we have a podcast series. We just started our 6th season. And so we have been doing expert interviews, conference summaries, literature reviews, hot topics, for 5+ years now. And the benefit of these is Dr. Meena Ramchandani, who is not only associate editor for the entire site, she also manages the ID fellowship program here. She really zeroes in on innovative and significant STD and STI issues. And this is one that she just posted. And as you can see here, these are all 2025 studies. You can access papers here. You can navigate here. You don't even have to listen to the podcast. You can just read the transcript, but you can also access the podcasts on most podcast apps. And then talk about innovation. We just launched this image library. If you have not visited the National STD curriculum since this fall, you have not seen this. This is dedicated to help healthcare professionals and trainees diagnose and treat STIs and genital dermatology. And we're serious here about this is an expanding collection. CDC is going to be transferring a lot of their images over to us to catalog and tag. So this will continue to build. And I just want to quickly show you how you would navigate this. So you can browse images by condition. So as you can see here, these are all the different conditions that we currently have. And I'm just going to choose Mpox. And so you see with Mpox, we have a total of 81 images, but you can select by clinical photos, you can select by illustrations. And let's just say, okay, hey, I'm doing a presentation, or I want to show my colleague, what a particular manifestation might be. You choose this, you will see a summary here of what you're seeing. And then you can download it for free. You don't have to ask us for permission if you're using it for non-commercial use. And then we provide the citation information as well for each image. So we hope you can check that out. We hope that will be helpful for you in trying to search images by condition, but you can also search images by description. So because there are a lot of graphic images, I am going to search by abdomen. And so you can see here, there's 17 total images. And I want to search by patient symptoms, and I'm going to choose painful. And so you can just, kind of mix and match, find what you need, and then either download it, put it in a presentation or in research that you're doing. And so you're welcome to do so. And then on the landing page and on this navigation bar, you will see this weekly quiz. So right now you have to visit our website. We're going to probably do something around subscription, but not yet. And so as you will see in this one, in all of our weekly quizzes, we have this context, right? What is this? And then we have the image itself, and then we'll ask a question, 4 choices. And then again, I practiced this before, so I know the answer, but I actually chose the wrong one too quickly. But you will say, oh, you answered it wrong, so here's the correct answer. There will be a summary, a key takeaway, which I really like, and then again, references, and then you can view the previous quizzes here, or you can go up and view the previous quizzes here. But as you can see, this is new. We just launched this in October. And then moving on across our top nav bar, our Mpox guide, in the hepatitis C online, we don't have any clinical guides, but on this website we do. And so we update these as needed. And this is just, you can navigate through here. You can just page down. Here's the life cycle, clinical presentations, manifestations, prevention, and, how do these different medications, what's their life cycle? So all of our clinical guides You are welcome to download them or you can share them. It's up to you. And then the clinical consultation, this is different than what's on the hepatitis C online because our national STD curriculum, we are part of the national network of STD clinical prevention training centers. And so you would fill out a form about your case, and then they respond within 24 to 48 hours. And then we do have a master bibliography that you can search, or by question bank, you can view by topic and author. So that is a very brief summary of the National STD curriculum.
Thank you, Julia. And I will do, again, just a brief overview of unique features on the HIV curriculum. So this is the National HIV curriculum. It does look different from the others as it's the last site that we're rolling over to the new platform, which will be done in a couple months. Like Hep C, this also has a medication section, and you can scroll down the drop down by type. Like STD curriculum, this also has a question bank, and here's when you're signed in, you can see your progress. And on this question bank, the topics are arranged to correspond directly to the lessons in the course modules. And we also have a National HIV Curriculum podcast, which launched in 2024. And this is really exploring practice-changing issues and updates. And it does this through 4 categories, these 4 categories here. And you can actually use these to filter by category or by different topics that are sort of through lines through the episodes. And then there are dozens of mini lectures on the National HIV curriculum. And these are sorted out by categories. So we have like mechanism of action or antiretroviral medications. And then there are also 17 screening tools and calculators. And on this site, the mental health screening tools tend to be the ones that are used the most. They're the most popular. And then we do have these 5 symptom guides, similar to the MPOX guide. And these really provide a practical framework for the most common symptoms that people with HIV may experience. And it includes clinical questions and decision trees. And like the other guides, these are also downloadable and shareable. And that is just a very quick look at the unique features on the National HIV curriculum. And then I'll turn it back to Julia.
Okay. Thank you, Todd. We are going to have a lot of time for questions, so but we just want to really just give you an opportunity to get a teaser of what all of our sites offer. So the National HIV Prep Curriculum, this is our newest one. We just launched it 2 years ago because there so many people who are eligible and to take HIV PrEP are not on it. So we decided we were, and we got funding from CDC and HRSA to create this website that will really provide this fundamental skills needed to assess, initiate, and monitor HIV PrEP. So you don't have to know anything about HIV per se to do this lesson. And similar to the HCV test and cure, it does offer that training certificate with that knowledge assessment test. And so this is the fundamentals module. So you can see, I mean, it really goes from basic principles all the way down to follow-up care and monitoring. And then we also have the second module. So there's a total of 10 lessons. We have this separate module which really zeroes in on key populations or different settings or how to implement, same day start for oral HIV PrEP. So those are our lessons. And then we launched an app. But it's an app that you can download, but you can also use this on the web browser. And the purpose of this tool is to evaluate people for HIV PrEP. You know, are they eligible? Is this the right medication for them? And then which medication? And then which laboratory tests are you going to do? And so you would just click on this, you're with the patient, and then you just ask them questions to walk through the assessment. Same thing with medications. You know, you're going to be asked questions, and then, you know, why do they want it? And you just kind of walk through, and then you come up with, okay, these are the medications that would be appropriate. And then the laboratory test section is great because, you know, once you're on HIV PrEP, you know, you need to then figure out first, you know, what are the labs that you need to do? And then how are you going to, so it's both initiation and monitoring. So right here, baseline and monitoring. So that is a tool that we have for people to continue as they're working with people, because HIV PrEP is still relatively new. And there are new medications being introduced, and so that HIV clinical tool there that we just introduced has already incorporated lenacapavir, and lenacapavir was just approved by the FDA in late July of last year. And so we created this guide, and so you can see, I mean, it's very detailed around missed doses and, you know, effects of other drugs. And so just these clinical guides are super helpful. And we also included this HIV PrEP studies because a lot of people aren't aware that HIV PrEP can prevent 95% of HIV infections. And so it's super effective. So we just kind of drilled down and showed you in a very simplified way all of these major studies that got HIV PrEP to be approved. And then, you know, this very handy laboratory monitoring. Again, just everything's illustrated. We try to make it very simple and easy to follow. So those are our guides. And then mini lectures. We have a few mini lectures, which interestingly, there's some about women because a lot of women should be on HIV PrEP and they're not. And then we also have a mechanism of action. And then the resources. This is great because, you know, clinics are like, whoa, how do we do this? How do we do finance, billing? So this organization will help you walk through, and we kind of show you how, and we link to resources. The National Clinician Consultation Center, which Todd already mentioned for HIV and HEP. There's a HIV PrEP line. And then this is around telehealth. How do you design and maintain one? And then the federal resources. So that's the main features of the HIV PrEP curriculum.
Great, thanks, Julia. And then the last of our curricula to talk about is hepatitis B online. And we just launched the 3rd edition in December. And on this site, I really want to highlight this primary care guidance. This is updated guidance offering recommendations for the prevention, diagnosis, and management of hepatitis B. And it's specifically for primary care providers and non-specialists. And this was developed by the Hepatitis B Primary Care Work Group, which is a multidisciplinary panel of national experts. And this site will host the most current version of the guidance. And some of this was updated just as recently as November, just before we launched the 3rd edition. And this shows there are 3 different ways to view the same guidance. So there's a full PDF version. There's also a 1-page summary. And then there is this more mobile-friendly interactive version. And there's going to be a free webinar about this updated guidance with the Q&A coming up on February 19th. And we will post the link for that in the chat for folks who are interested. And I wanted to highlight that in the medication section on this site, it also includes information on the vaccines. And there are 12 clinical calculators, including this page B risk score, which is specific to hepatitis B. And then this site also has several clinical challenges and mini lectures as well. And now I'll send it back to Julia.
Okay, thank you. So I am going to share our acknowledgements. So these are just our acknowledgement to our funders. And so for hepatitis B, hepatitis C, and then the National STD curriculum, our National HIV prep curriculum, which is funded by both, and then our HIV curriculum. And then we're going to keep this slide up. And then I think Todd will or has added to the chats the links to the different websites, but you can also just, use these QR codes. But we are done with our presentation. So if anybody.
Julie, did you want to talk about learning groups?
Oh, you're right. I do want to talk about learning groups. Thank you, Todd. Okay, I am going to stop sharing this. And thank you. And I am going to share just a second here. So the learning group features is we kind of touched on it briefly there with when I was going over the features from the main page, and I need to sign in to show you the learning group features. So just 1 minute. So learning groups, to be an owner or a manager, you have to, and actually a learner too, you have to be registered on the site. And so we have a learning group page, like what Todd was showing earlier on this left. You can access it through here. And we have about a 2.5-minute video about the benefits of creating a learning group, but more of a focus is on how to create it, how to manage it. And so what we really are seeing are, clinics with multiple sites, or they're using it to onboard new people, or to do it in a flipped classroom model. So a lot of medical schools and nursing programs have also created learning groups. We have short PDF guides that people can look at. But let me just show you a learning group, and I actually chose the wrong sign-in sheet. Sorry about that. So I will show you a sample group that we have, and so this is the landing page for what your learners will see, what your members will see. So you can have like, okay, this is the purpose of the learning group. You can have the instructions for the learning group. And then you can see your members in the learning group. This is now what only the owners and the managers can see, and only the owners and managers can see the progress. So this is the 10 lessons that are in the National STD curriculum. So you can just hover over to see, and then you also see genital herpes there, and then you see, okay, they finished, the check mark means they read all the topics, and then the score, that 80, is what they got on the quiz, and then you can see what type of CE they earned. But you can also see, okay, they've only done 14%. And then the question bank is a similar process, but since there's 29 and we needed to get them all in, you really have to go through. And but it's the same idea of, you're seeing how they did they earn CE? And if you get a lot of members, you can just search for people from your long list of people. And you can also go back and see on a previous edition. So, as we're launching new editions, you might have a learning group that spans 2 different editions. So you might have to kind of toggle between the two. So yeah, that's what the learning group. And so again, you do have those resources available for you on that page. And so now I'm going to go back to what I started. Well, I already showed the acknowledgements, and so I am just going to show or end with this slide. So, and to see if anybody has any questions.
This is amazing. I got stuck on the pictures. I've never actually seen monkeypox or secondary syphilis, so now I have. Um, yeah. Okay, let's see. We do have some questions here. Let's see. Thank you for sharing your exciting presentation. Can learners from other medical schools like JABSOM access your curriculum?
Anybody can access our curricula. Internationally, nationally, there's no restriction on accessing our content.
This is amazing. A
And
great resource.
And are we still getting CDC funding for updates and new programming? Yes. We got notification recently for the National STD curriculum and our 2 hepatitis websites that our funding will be extended for another year. We're on 5-year funding cycles, but due to the current budget conditions, they're just extended it for 1 year at this time. But I don't know if you all are aware of it, but in the current budget, the hepatitis, there's a special money set aside for additional hepatitis funding because it's, a lot of people in the baby boomer generations, they actually have the highest rates of hepatitis C. And that turns into cirrhosis and liver cancer. It's one of the leading causes of liver cancer. So, oh, I'm glad that people found this helpful. Looks like all the CEs are for nursing. So that's a good question. So social work, a lot of times you can earn a CNE and they will accept that for social work CE. I recognize that it won't be all, but I would recommend getting CNE because then you can see the contact hours. And when you look at the CE notices on our pages, we specify that, it could be applicable for dietitians, mental health people, mental health professionals, and DIS. And we did not mention this in the talk, but we wanted to let you know that when we launched the National HIV curriculum in the 4th edition on September 1st, our University of Alabama, which has been providing our CME for 15 plus years or whatever, they recently got joint accreditation, and so we will be able to offer APCE, so CE for pharmacy, on the National HIV curriculum. And then as we because we had the University of Washington continuing nursing education for many years, and then they sunsetted their entire program. And so we had to switch to the Oregon Nurses Association. And within a 6-month period, which was kind of crazy. But everybody who earned UW CNE, they can still access their archive CNE certificates through our site. But anyway, long story short, the Oregon Nursing Association only offers 2-year accreditation. So we will be switching over to that joint accreditation programs as we launch the National HIV PrEP curriculum next January. And then we launch Hepatitis C Online. We'll go to 5th edition, and National STD curriculum will go to its next edition in April.
Amazing. Are you adding more pictures? Because I noticed some had just drawings.
Yeah,
Should we send you pictures if we
yeah,
get
it's an expanding collection. What happened is we're having some technical difficulties in getting some of those images, partly because sometimes people don't have a signed release form. And then we have to de-identify, and then we're working with the CDC to really coordinate a massive download of images, because they don't really want to host them anymore on their site. And so we will be able to host them on ours. But we have had a lot of our images, we have paid for years for a physician assistant to take photos at the Seattle King County Sexual Health Clinic. But you did see some images. We are starting to get some images like from our contributors who are sending insight. So it's expanding. We're continually expanding.
excellent? Yeah, really, really good. Dr. Ware wants to know if there is AMA credit.
Um, well, it's all of our CE is through American Medical Association. And so they are approved as that, title category 1, I believe. And we didn't mention that the National HIV PrEP curriculum is now listed on AMA, has the AMA Ed Hub, and that's their platform. Like, I don't know how many of you are familiar with CDC Train. If you're not, I highly recommend that. And all of our content is listed on CDC Train as well. But we are also now trying to, oh geez, I did not press that webinar link, did I? I'm so sorry. That's the webinar link. I wrote it, but I didn't post it in the chat. That the AMA EdHub will be starting to post a lot of our content on the AMA EdHub as well.
One of our participants said incredible, and I have to agree. Yeah, wonderful.
Yeah, and we are always open to feedback. And as Todd shared, how to do access intercom, that little blue button. And then there's also a contact us if you're not a registered learner. And so we try to respond very quickly to questions. And if somebody finds an error, Dr. David Spock, who's our editor-in-chief, will be on it to make sure that content is full and complete. But I do apologize. I added the link, but I didn't hit post. But this HPV guidance webinar, we encourage you to join it. One of the key persons who updated it will present on it. And then there will be that question and answer panel with many of the workgroup members. And it's free.
Excellent. Well, thank you so much. Does anybody have follow-up on any of their cases from past month or a new quick case? If not, any more questions? Okay, well, thank you so much. Have a lovely rest of the day. And this was really enlightening. And boy, they're really good pictures.